Come on in. It's time for another Bridging Insider, and you may notice that it's different. We're actually in the office today because the studio is moving, and we'll be back there in a couple of months. So you get to see what the actual office looks like. And today our guest is Cindy. And Cindy, how are you hoping we can help you?
Well, pick a project. I got lots of pain in different areas, mostly back and neck.
Okay.
So I'm hoping maybe you could help me with that.
See what we can find. Well, we have met before. It's been a few years, and you've had a few things happen to you since.
I did. I had a hysterectomy, full
Okay.
hysterectomy, and a hip replacement.
Okay, so those things could maybe lead to some back pain, and sometimes back pain leads to neck pain.
For sure.
So we'll see what we find. So by the way, I'm Cara Lindell, and I'm the founder of the Bridging Institute and the Bridging Technique. And the Bridging Technique is based on my unique background as a systems engineer and a movement specialist. And we use the physics of the body to figure out where the flows aren't working so well, and that causes pain and also movement challenges. And we use that to put you back together, and away you go. So let's see what we find. So I'm just going to have you stand here, and we're just going to see how easily you're moving from side to side. Wow. Okay, we got to be careful with that. And just a little turn. So we'd like more control on that, side to side. The turning was okay. And we're going to go a little forward and back. And that's not bad, but could be better. And I'm going to have you sit down. We're going to see the same thing. Okay, so we're going to do a little side to side. Uh-oh. She goes to the left, but she does not come back to the right. And the right hip is the one that was replaced, right?
Yes.
Did they do anterior or posterior?
Anterior.
Okay, so we've got some disruption in here that may not be transitioning so well. And if you can't sit so that you've got motion this way and that, and for work, do you sit?
I do.
Okay, so that's going to have you more centered over this way, which is going to put your head over this way, and that will cause some stress. So, all right, we've got one possible line of way of helping you. So let's see about forward and back. Excellent, and turning. Okay, so turning, so it's interesting, you're moving not too differently right and left, but it's all up in the upper part, and if I hold in the middle, she turns to the left and does not turn to the right. So there is something going on from the hip or the lower part of the core. So on your back, let's see what else is going on. So we're gonna just lift each leg. Let me do it. Okay, well that could be lighter. And let's see how it turns. And it could turn better because it's sort of not. And this one could be better too. So I'm gonna see if hips are moving a little bit. And quick check on the shoulder, relax. Do a wee wiggle here, yes. And a little stretch, yep. And see what we got on this one. Relax. Oh, not as nice. And it's a little tight there too. So right side is just a little tighter than the left. Let's see how they go together. I'm gonna grab an arm and a leg. And you're not coming this way, are you? All right, let's see if you roll the other way. A tiny bit. So both of those could be better. Let's see about shoulders. Love it. And your head doesn't move. No wonder your neck is bothering you. So hopefully, as we do some work to support where you've had some surgeries in the lower body, that's going to let your back relax, and then your neck will move more easily. I keep finding that a lot of times when neck is stiff, it actually isn't from the neck, it's from the lower body. So roll on your stomach, and let's do a quick check of a couple other things. I'm going to see how you're moving here, and the left side moves a little bit. The right side where that hip was replaced, no moving. And let's see how Her leg does not extend, as in kicking for walking and running, and this one a little bit. And let's see if it can swing out. No. And does this one swing out? Nope, let me do it. Oh, no. That's not going anywhere. Okay, let's check shoulders. Oops. That one moves great. And so does, oh, those are fantastic. Okay. So again, I find that a really great position to work from is how we sleep. So how do you end up sleeping? Back or side?
On my stomach.
On your stomach. Okay.
Like this.
Crooked on your stomach.
Crooked on my stomach.
Okay, but we're closer to the right hip. So, you know what? I actually think we want to do a little work because of having the surgery and the trauma on that hip. So let's, why don't you sit up? I'm going to have you kind of switch around. Let's see if this is a good substitute for pillow. If it's too high, let me know.
That's okay.
Okay, so let's see what moves here. Oh, no, no, no. And shoulder does. Good. So normally, I'm going to tell you that we work from what moves into what doesn't. But because she had surgery here, we're going to support that and get that area to function better and see if getting how the muscles interact through the hip, if that takes care of a lot of the rest. So I'm going to use one of my fun little peanut toys, and we're just going to hold that and give it some support. Is that about where the scar is? Or okay. Sometimes they're a little different from person to person, but just holding and giving it some support and just giving it a little movement. And then our back starts to move. Yay. All right, and then I'm going to support your knee with this. And I'm going to see if we can get your hip moving a little bit better. We're going to still support where the surgery was. And that was long enough ago that you don't have restrictions on how it should move, do you?
Correct.
Okay.
Right.
A year ago, yeah. How long do they give restrictions now? Is it for 6 weeks, 6 months?
Pretty much. I mean, I'm not supposed to do any crazy yoga moves
Okay.
pretty much ever, but he said I could start skiing again, so that's good.
Skiing on a fake hip, how about it? The things you can do these days. Did you ski before?
I did.
Okay. So then that's a good change. Here. So one of the things when we have joint replacements, we have to think about what may have been going on before, like with compensation. Was it the pain while you had it replaced?
Yes.
Okay. So, you know, if you're in pain, you're not walking really well and you're probably sitting a little differently. So it's as much the recovery as it is the compensations beforehand. Okay, we're going to straighten your leg and we're going to just let it roll. Oops, I'm going to change this around. There we go. Going to help it. Remember, there's a few more ways to work than just bending and straightening. I'm guessing when you got your head exercises to do, you probably had a variety of them.
Yes.
Yeah. So the difference with me doing the motion and you doing the exercises is when you do the exercises, whatever muscles are going to work to get that to happen are going to be the ones doing the work. And I'm looking for very specific ones and very specific aspects of how it moves. So it turns in, and then hopefully we're going to get it to turn out. There we go. Because core and leg need to work together. There. Did they have any guesses as to why it needed to be replaced?
They said I had hip dysplasia since birth,
Oh.
which I never knew. I never had any issues other than
That's
it was
interesting.
just hip pain kind of that just got worse and worse.
So what hip dysplasia means is that the hip doesn't really sit in the socket the right way.
Right. They said that basically my socket wasn't grown
Oh.
fully
Okay. Oh, there we go.
in layman's terms, you know.
Yeah. Okay. So feel how it's moving now?
Yeah.
Yeah. Okay. I suspect there's probably a little bit more that your leg would. Oh, There, that's much better. I suspect there's a little bit more range of motion for it, but just to get that from where we started is a big change. So let's see if that's moving better through your back. So your back actually wants to move backwards, the lower part. And I would guess this is from the original, like just how you were before it was replaced, that you probably favored the left side a little bit more. There.
I have always had back pain for as long as I can remember.
There. Oh. And just because of the other surgery, we're just, what they took out took up some space, and we're just going to give it some support and let the front and back remember how to work together a little bit better. There we go. And then we're going to do the same thing on the left leg, and just to make sure that it matches up. There. And then the body organizes around the middle, so we're going to hold what's called midline on the front and midline on the back, and just kind of hold those and help them remember that they need to coordinate with each other. Yay. Terrific. Okay. So if it's easy enough for you, why don't you swing legs around, and just to switch sides, flip this way. And here's the... Here. Okay, so to start with, let's see how this is moving. Pretty good. Shoulder pretty good. And let's see about leg. So it just needs a little bit of support and a little bit of refreshing. Oops, I'm going to put this underneath it. There we go. And we're going to hold front and back. And there. Sometimes when abdominal surgeries, as they're healing, everything to heal, the body protects because it wants to heal. But it doesn't know when to stop protecting after it's all knitted back together. And so we find that just adding some support and then refreshing the motion lets the muscles get back to actually dynamically working together instead of just being there. And there, did you feel that change? Okay, and then your hip starts moving. So yeah, just whatever was kind of still protecting in the abdomen from the hysterectomy was probably holding that a little stiff. And their hip moves pretty nicely now. And get this out of the way. So a couple common questions people have after we're done working are things they should do, shouldn't do. So you're going to stick with your no crazy yoga. And we just want to get you so that walking and sitting feels better. Okay, that seems pretty similar. So just roll back on your back and let's recheck where we started. So, oh my gosh, that one's easier to lift, and that wasn't the heavy one. This was the heavy one. And it turns, and this one turns. It's pretty good. Okay, let's see if this moves, and this. Oh, they're actually even now. They both have some movement to them. And let's see, I think shoulders were okay. What we weren't able to do was turn you very easily. So I'm going to roll you toward me. Yay! That's a nice change. And let's see about this side. That too. And they're pretty similar. Okay, let's see if your head moves. All right, so it turns and it turns and goes to the side. And does it go forward and back? How about it? All right, the other one I do want to make sure is better is if you flip on your stomach, I want to make sure that some hip movement is better. So again, this relates to walking. Yes, you've got that kick back. So walking, when you can't get that extension at the hip, you're going to start using your lower back, and you already had lower back pains. So let's see about the left. Nice. And does it turn? Okay, that turns about as much as this one. So this one's still a little bit limited, but it's got a lot more movement to it than where we started. They're not exactly matched, but they're fairly close. Let's see what's going on here. Okay, and this matches now. And shoulder, shoulder, perfect. Why don't you sit up? And so the one other thing to keep in mind, because these were surgeries that traumatized your body, from what we did with getting the muscles to restore, there's actually a little bit of healing for them to do, so it may be a little achy for a couple of days, and then it should go away. So let's see if you go side to side better than we did before. Yeah, good. So you're centered with that. So it's not a lot of movement either way, but it matches, and that should allow you to sit up and not stress your back so much. Oh my gosh, those are actually easier to move. Stand up, let's see. Perfect, okay. So here's what I like. You're not falling over. Okay, and then we're gonna turn, and that's a little bit more fluid. Oh, I forgot when we were sitting down. So she's moving through the middle, not just up at the shoulders. And just gliding forward and back, and that's much smoother too. And it feels like there's more control to it, because before it felt like I kind of had to guide you and keep you from falling over. So great. Any questions?
How often do I have to come back to see you?
Wow.
Would you recommend?
You know, if for what we worked on today, I would say maybe one more time. And so we might have an opportunity to have you come back and check in. So that would be great, because they are a little different from each other, but I do think all the movement from your lower body will actually help just in general your back, and then also your neck. So whatever was pulled in there was kind of tightening up everything for you. Okay. So kind of...
We'll see you again.
Kind of simple. But so for those of you at home, it's not always so simple and straightforward. It's just there's a surgery and this is what happened, and we address that and everything's get better. Sometimes there's a little bit more to it. And so that's what we teach in our course, and you can see information on that in our show notes. And if you also had a surgery where you're just not quite back to normal, there is a little bit more of helping those muscles relearn how to work together. And that's what bridging does. So you can give us a call, look at the website, and find a way to make an appointment on your own. If you enjoyed this episode and found it interesting, another mystery solved, give us a like and subscribe to the channel so that you get notices of when we have a new episode posting. Thank you, and thank you.